Welcome to another episode of RX Know, where we uncover the different medications that are utilized throughout the world and provide you the information that you need to see if you're taking the medication or considering it. Today, we are specifically going to be speaking about finasteride. So, the reason this is the topic for today is based on the article that just came out last week about a top surgeon's warning on a hair loss drug, finasteride, as it was linked to permanent genital changes. He also discusses some depression changes, suicidal ideation, and other sexual dysfunction. So we wanted to investigate exactly what that means based on the information that we've provided at RxKnow. And we're going to go through that right now. So first thing we do is we look at the disease. You can also go through medication. This is based on alopecia, hair loss, top medicines. We're going to look at finasteride. Again, this is generic. Finasteride originally was called Proscar, and it was used for BPH. Then they determined that it had benefit in maintaining hair growth or sustaining hair. And then when it was launched at that point, it was called Propecia. So first thing we're going to do is when we look at finasteride and what we're offering for educational resources on RxKnow is look at the medication guide, also known as the package insert. So as we showed before on page 1, first thing you want to do is look at the indication. So we'll highlight that. Propecia, finasteride, is a 5-alpha reductase inhibitor, and it is indicated for the treatment of male pattern hair loss. It is not indicated in the use of women. And this goes to a specific warning and precaution, which is it should not be used in women or pediatric patients. They should not even handle it. And you have to be very concerned about any woman coming in contact with finasteride. And we will speak specifically to that in pregnant women a little bit later as we analyze the medication guide. First thing we want to do is just look at the clinical trials that were done on Propecia. Now, this is about a 2,000 person trial that was done. This is the adverse events around it. Finasteride was at 1 milligram, and this is a study to assess treatment of male pattern hair loss. Some of the side effects that are listed in the medication guide: decreased libido, erectile dysfunction, ejaculation disorder, and then they also look at discontinuation. So that was for the clinical trial. Then if we want to go deeper in the medication guide, we look at post-marketing experience. So these are the quote adverse reactions identified during post-approval. That means after the drug has already been on the market and used by a number of people. And these reactions are reported voluntarily, so they don't quite know the size of it. But what we can know is that the reports related to the reproductive system for people that were taking it in the market after it had already been approved were sexual dysfunction, which often occurred and maintained after discontinuation of treatment. It's very interesting. Erectile dysfunction, libido disorders, ejaculation disorders, orgasm disorders. You get the trend here. There was also breast disorders, male tenderness and enlargement, and nervous system psychiatric disorders that we spoke about briefly. Depression, suicidal ideation, which is a very scary side effect overall. The last area that I want to bring to your attention on the medication guide is the area around pregnancy. And I want to highlight a very specific area around this. Now, it's not related to a specific study. However, it is related to the pathophysiology of the human body and what they know about the mechanism of action of this drug. And I'm going to quote specifically from the package insert of finasteride when it was launched. Abnormal male genital development is an expected consequence when conversion of testosterone to 5-alpha dihydrotestosterone is inhibited by a 5-alpha reductase inhibitor. And remember, finasteride is a 5-alpha reductase inhibitor. So that's a fascinating line that's in the package insert, and anybody that is utilizing or considering utilizing finasteride should look into that specifically. So then we look at new articles. Now, as we look at new articles, the idea here is to address it from an alopecia standpoint, but because we're looking specifically at side effects, we're going to change that, and we're going to look at sexual dysfunction and see if we get any articles related to that. And here's the article I was hoping was going to pop up. So this article is actually free, which is great. And it's an assessment of the adverse events of finasteride. And this is based on the real world pharmacovigilance analysis of the FDA reporting system. Great thing about this article, which you can access through our portal, if you click it, you both have the abstract, which are the background methods, results, conclusion. And in this case, there is actually free text. So you can click on the free text. It will pop up and you will have access. You can download the PDF and read all about the analysis that was done in the FAERS database of the FDA of the side effects that were reported. So that's very important. So we'll get out of this area from finasteride. So we've looked at medication guide. We've looked at new articles. There's really no new clinical trials being done in finasteride for hair loss. And the last area we want to focus on is adverse events report. And this is the origin of the article. Now, what we want to do is look specifically at finasteride and what's been reported to the FDA. And in order to do that, we just have to log in real quick, accept. All right, we will accept. Easy. We will type in finasteride. Go, and we will get a report of the data that was presented to the FDA. So again, this is called the FDA Adverse Events Reporting System. We call it FAERS, and this is a public dashboard that we're looking at. So a lot of counts, high percentages by year. You see some of the numbers vacillating a little bit. The area that we like to look at specifically is events. And when we look at finasteride, it has quite a few events over the last 2 years, quite high. This might be related to the abundance of use on online pharmacies, but we can't make any assumptions there. What we want to look at is the reaction sites, or excuse me, the reaction areas that have been reported. So the one we want to key in first is reproductive system and breast disorders. So again, we're trying to prove out the information that was provided in that article and whether it was based on the facts that we have on our website. So erectile dysfunction, 4,500 accounts or reports of this. And then here are the others. Go down and you can get on and look at the sexual dysfunction, gynecomastia, that's breast enlargement, ejaculation disorder, testicular pain, breast pain, ejaculation failure. And here is a horrible, horrible side effect, penile size reduction. And this was brought up in the article. And then again, you have some other areas in here that you can look up and, go through them. Another interesting area that they had brought up in this was, we go back, psychiatric disorders. So this was brought up in the article and also in the post-marketing. Depression, almost 3,000 cases, anxiety, decreased libido, loss of libido, insomnia, and the very scary side effect of suicidal ideation, nearly 1,300 reports of this. And remember, we also saw this in the medication guide under their post-marketing surveillance. So there are other areas that were reported as well, but those are the two that we focused on in the article. So basically, as we look at the article and we do an analysis of finasteride based on the information on RxKnow, we think it's important for anybody considering finasteride or on finasteride to look through our website, go on and find the key information, analyze it, print out where you can read the articles, the package insert, the adverse event reports, anything that's provided through our website to help you make proper decisions about your medical choices and medication choices. As we say at RxKnow, get smart, know your medications. Thank you.